Hi, I wanted to talk for a moment about the situations in which we might recommend a local therapy for patients who have advanced or metastatic lung cancer. The general rule is that in patients who have early stage cancer that is limited to one area of the chest, for instance, that's a situation in which we use a local treatment, something like surgery or radiation, that is directed to the disease that you can see. You do surgery to resect the tumor, or you do radiation to focus the beam right where you see the cancer. And then there's also the different treatment strategy of a systemic treatment, a whole body therapy, such as chemotherapy, which is typically given by vein, or targeted therapies that focus on a specific molecular target. Those can be oral, those can be intravenous. But in any event, those therapies are really given to treat disease outside of just one little area. And those whole body systemic therapies are the cornerstone of our treatments for advanced or metastatic disease. When someone has metastatic disease, we generally don't favor giving local treatments, and that's because there isn't a clear value in focusing on just one area of the disease when the process is really a whole body one. Even if you can't see disease in other places, we know that if a cancer has gone to the liver, to the bones, to the adrenal glands, brain, etc., from the lung, then that means that there must be microscopic cancer cells that are circulating in the bloodstream and that can cause further spread of the disease down the line. So even if you treat all of the disease you can see aggressively with surgery or radiation, you're still going to very likely see disease emerge in other places. And so because of that, we generally favor giving whole body therapy as the mainstay of our treatment for patients with more advanced lung cancer. Now, there are some exceptions to that. First of all, there can be settings in which you can develop local immediate problems from one area. That might be spread of the cancer to the brain, and chemotherapy and other targeted therapies don't tend to get into the brain as well as we would like. And so radiation typically to brain metastases is the most common treatment that we recommend in that setting. There's also the situation of coughing up blood, and that might be from a tumor in the chest that is invading into a blood vessel, and radiation tends to be the best treatment in that setting as well. You can have a bulky cancer that is pressing against an airway, and if you need to shrink the cancer in one area in a hurry, radiation is more reliably going to do that than a whole body therapy in most cases. And then there's another situation that might not be just to palliate a specific symptom of from a tumor in an area, and that is the situation in which you have something technically called metastatic disease, but where you have one area of the disease that is really far outpacing the disease everywhere else. And I saw a patient just in the last few days who really illustrates this. She has what is technically stage 4 because she has spots of what are called ground glass opacities, little hazy lesions in the lungs. And one of these has been biopsied and shown to be a slow-growing adenocarcinoma. But there's also a larger and more symptomatic, really the only area of symptomatic disease, higher up in the lung. And that is causing pain and causing a cough. And on a PET scan that shows metabolic activity, it's really just that one area that is lighting up as being more aggressively growing on the PET scan, with everything else in the background really being very quiet. Now, this is still a disease that is not just one area, so I don't know that we could really realistically say that we could treat it for cure. But this is a situation in which there might be just this one faster growing area causing problems far faster than everything else in the background. And that's a situation in which we really might consider a more aggressive approach focusing on just that one area. So this is not a textbook answer. There is no textbook approach to this situation, but it's one in which I and my colleagues, various other cancer experts, might favor giving a local treatment to one lesion, even in the setting of a background of other disease. But if that background disease is moving so slowly, we really might just focus on getting out the lead runner, to use a baseball analogy, because that most avid, pet-avid, hypermetabolic and aggressive disease is likely to be the problem that is setting the pace for the overall cancer. I hope that's helpful. Take care.